this is another cat that I'm going to use to give you another subcutaneous demo. This one's a little bit more relaxed, and like some cats, we'll find that you'll have a comfortable bed or a carrier that they like to stay and that they feel secure. Depending on the cat, again, you'll just want to do it wherever they're most comfortable, whether it be a bed or like their carrier. So again, you'll be doing the same thing as what I've demonstrated with trying to find that area behind the shoulder blades. As you can see, again, I'm going to just tent the skin gently, and I'm going to, as pretending with my finger, that that's the needle, and that's the pocket or tent where I'm going to go, where I'm going to insert the needle. Again, I always recommend doing this periodically throughout the day. The reason for this being is that your cat gets comfortable with this technique, and that doesn't always assume that when you're going to poke, that's when the poke's going to happen when you only do it once a day. So this is Squiggles, and Squiggles is going to help me demonstrate giving some sub-Q fluids. Again, you're waiting for your cat to be in a comfortable position, and you get everything set up prior to doing your administration. Always make sure that you have a fresh needle on your IV set. And always making sure that you're ensuring that your pet, either by talking to them or petting them, and making sure that they're feeling comfortable. So doing this again, I'm right hand dominant, and so I'm going to do the tenting and poking and pretending with the needle where I'm going to go. Taking the cap off. Now again, making sure that your bevel is up, and which is the angle of the needle. Again, I'm taking my finger, making sure I'm going for where the pocket is that I'm going to insert. Then again, I'm going to pretend with my finger first of where I'm going to tent, where my needle is going to go. And then I'm just going to do a gentle pop into the skin, and I'm just going to hold that there with my other hand. With my other hand, I'm going to release the locks. First, the rolling lock, just gently rolling it up, and with the C lock, unlocking that. And as you can see, now it's going to start to flow. The flow will depend on how high you have your elevation of the fluids, or depending on what size needle you're using. Again, also sometimes will vary depending on what angle your fluid is in the fluids. So sometimes you'll have to rearrange your needle underneath the skin to try and increase the fluid rate. Sometimes you can do a gentle squeeze to increase this fluid rate. As you can see, as you're watching here, the fluid is now flowing more readily. And as time proceeds, you're going to see a little camel hump. And that is completely normal and to be expected. If you do ever notice any fluids leaking, just stop and redirect your needle. As the conclusion of getting all the sub-Q fluids, again, go to lock my lines. There's the C lock and your rolling lock, making sure they're in the both locking positions. Then you just gently pull out the needle. With your other hand, you're covering the hole where the needle is coming out to prevent any leakage with the needle, and then you're going to cap the needle like so. Again, don't use your other hand to try and do it because you might poke yourself. This will minimize any type of injury. Again, I'm just holding here just to prevent any leakage. If you notice that there's any pink linkage, that is completely normal. And depending on your cat will also depend on how fastly absorbed it is. And it is completely normal sometimes with gravity with the fluid to go down into one leg or the other. That is to be expected. And that is Squiggles for giving the sub-Q fluids demo.